so excited to introduce our next speaker. Our next speaker is Derek Donegan. He is the co-founder of ORtelligence. ORtelligence is an AI-enabled platform that digitizes and optimizes the operating room supply chain to drive teamwork, efficiency, and quality. And he'll be presenting driving efficiency and improving patient care, optimizing the surgical process. Take it away, Derek.
Thank you so much, Deborah. It's an absolute pleasure. Hopefully you can hear me okay, and I'll share my screen. All right, so thanks again. As Deborah said, my name is Derek Donegan. I am the co-founder and one of the managing partners of ORtelligence. I'm also an associate professor of orthopedic surgery and orthopedic trauma surgeon at the University of Pennsylvania. And so today I want to talk to you about our journey in driving efficiency and improving patient care through optimizing the surgical process. I have to say, to be an orthopedic surgeon, the previous talk is near and dear to my heart, and that was just absolutely phenomenal. So kudos to them. Anyways, so as far as this surgical process is concerned, if you think about to be at their best, the surgical team needs to function with precise coordination. That means harnessing communication, expertise, and equipment, all at the right time for the right reasons together. I often correlate this to being a race car driver. A race car driver is really only as good as his pit crew. If the pit crew is not functioning at its highest performance, there's no way that driver will ever win that race. So together, as a surgeon and a surgical team, we need to function at our best to provide the optimal care for our patients. Unfortunately, today's system is highly fragmented with outdated processes, wasted resources, overburdened staff that often compromises patient care. With the increasing complexity of surgery and the silos of departments with antiquated communicating processes, this leads to multiple gaps. Gaps in knowledge, gaps in communication, and gaps in inventory management. And instead of providing acts of healthcare that are guided, targeted, and precise, oftentimes we are just performing random acts of healthcare each day. And to be quite frank, I am amazed at our ability to provide the care that we currently do in the current environment that we work in. So let's break it down. Let's do a real-time gap analysis here. So gap number one, the ability to select the right equipment. Equipment is very complex and always changing, with multiple trays and multiple tools and implants for each tray. Each surgeon, including myself, we have our own preferences based off our own unique algorithms for how to approach a case over experience and time. Existing documentation practice is unreliable, often because it's manual, hard to update, and hard to share. And even the EMR that we use today is really clunky at times and difficult to manage. Our knowledge is siloed and non-transferable, accumulated by individuals over time and compounded on experience. And all this leads to a situation that's nearly impossible for our staff to know exactly what equipment is needed at the right time. So this is an OR booking card. If you see the date, it's actually from 2020 from a very large health system, not too far away from me today. And this is how it was booked. It's handwritten on a card. These processes are antiquated and honestly the norm throughout most of our country. Gap number two, access to mission critical information. So department systems are often disconnected, leading to communication delays and inaccuracies on how we communicate with each other. The processes are antiquated and not standardized, with information often relayed by phone, handwritten notes, emails, etc., with no automated checks for omissions or errors. So easy for information to be incomplete or incorrect in critical times. And there's often very little or no visibility at all into the communication flow, with no receipt of acknowledgement of any changes or updates that happen. This all leads to our staff not having the information that they often need, and that problems with equipment that are needed are often unknown for as far as things being unavailable, missing, or broken. This is a typical setup in the OR. You can see on the left and the right, the left is a spine surgery, the right is probably a fracture surgery in orthopedics. There are multiple trays, multiple pieces of equipment, and multiple people that actually participate in the care of this patient. And so chaos is typically the norm. And oftentimes we're trying to organize chaos on the go. The third gap is experience in handling the equipment. There's a lot to know. In this healthcare environment currently, surgeons are being driven to become more and more specialized, while staff are being driven to be broader generalists. So as our complexity of equipment keeps increasing, the number of vendors keep increasing, and so does knowledge base keeps going up. Most of the staff today are generalists, while also supporting these highly specialized surgeries. And unfortunately, there's often a lack of oversight or training to compensate for this lack of experience, just because the amount of people they need to train and the time they have to train them to get there. So this leads to a situation where the staff may process the equipment inconsistently, and the staff may not know exactly how to assist and use the equipment in the operating room. So let's take a look at this by the numbers. So again, general trained staff is required to support highly specialized surgeries with complex equipment from multiple vendors. If you look at it, scrub techs and the sterile processing staff with the least amount of experience and training are often required to understand the most number of sets and the most number of instruments and have the most touch points with all these pieces of equipment throughout the given day or the cycle of care of a patient. The fourth gap, the ability to record accurate data. Manual human data entry is highly inaccurate and the norm today in our healthcare systems. There's some studies that show that nurses take up roughly half of their time charting instead of taking care of patients. And it also takes away from other tasks at hand that are super important to caring for our patients. This leads to a situation where hospitals don't know exactly which implants, supplies, and instruments are actually being used, which takes away from their ability to restock the vital pieces of equipment and even to build processes and that equipment that's needed for later. So let's look at the impacts that these gaps actually have. So when a surgeon's preference don't really align with optimal equipment selection, that can ultimately lead to higher costs and compromised patient outcomes. This has been studied by a very large academic center quite eloquently up in the New York metro area, looking at intertrochanteric femur fractures for a geriatric patient population. The use of a sliding hip screw versus a nail device for simple, stable patterns versus unstable patterns, just by communicating the pattern of the fracture and the optimal implant choice, they've realized savings up to 50% on their implant costs, just by enlightening the treatment algorithms. What about the impact of staff knowledge? So when staff don't have the right knowledge or information or experience, this often goes to the equipment in the OR being missing or wrong or unusable, or again, staff not really knowing how to assist with the equipment. This leads to confusion and stress, and oftentimes possibly delaying care. A great example of this happened to me about a month ago. I was fixing an open ankle fracture in the middle of the night, and we need power to put to drill holes and put screws in. We get the case started, and the power actually wasn't available, so we had to ask for the power real time. And that led to us sitting there really in idle for about 7 to 10 minutes in the operating room while we were looking for this equipment. Not ideal for patient care. So when this does happen, this lack of knowledge, oftentimes the staff overcompensate to avoid problems. This leads to waste, inefficiency, and again, higher costs and delay in care. This again happened to me about 2 weeks ago. Doing another case, I asked for a specific set, which was not on the case card. It was not open. When I asked for an intraopt, they were actually unable to find a set because what they realized were all the sets were mislabeled. And so what that led to happening was the central processing department actually opening multiple different sets to try to find the correct equipment that we needed at that time. So again, leading to a lot of waste and inefficiencies in the process. And lastly, with this lack of knowledge or information experience, we often rely on our third-party industry representatives, which they are a vital and critical part of our team. But oftentimes this leads to sometimes higher costs and sometimes higher infection risks to both the patients and to the staff themselves. Again, about two and a half weeks ago, I was fixing a tibia fracture on a patient who was COVID positive. We were in a room where the surgical assistant and the circulators were not that familiar with the instruments that were being used. And in order to safely take care of this patient, the sales consultant had to be inside that operating room to help assist with the equipment, affecting, and exposing this individual to, again, the risks of interacting with a COVID positive patient. So again, there's lots of impacts on these gaps that we see throughout the process. So what's the problem? At the end of the day, these antiquated manual processes, disconnected communications, and increasing complexity of instruments leads to inefficient operations, impeded teamwork, inconsistent delivery of care, and limit institutional learning. The case for change is there. The last 5 to 10 years, these problems have been brought to light and continue to be highlighted, not only in scientific articles, but also in the mainstream media. Awareness of the overburdened systems and costs associated has increased, not to mention the negative effects all of this has on the workforce, with physician burnout and suicide becoming a top concept and discussion point in all of our circles, and the decreasing workforce throughout the hospital from nurses and scrub techs and the vital people who are instrumental to taking care of patients. So with that, in our personal experience, we thought there has to be a better way. How can we make this process better? So we set out to digitize and optimize the surgical process to drive teamwork, efficiency, and quality in the OR. Our idea was pretty simple, really. It was to digitize the process and utilize AI to empower all surgical stakeholders to drive teamwork, efficiency, and quality. Our value prop is pretty simple. We deliver an AI-enabled platform that digitizes and optimizes the operating room supply chain to drive teamwork, efficiency, and quality. And really, we set out to empower all surgical stakeholders with one central platform for scheduling, logistics, communication, virtual surgical support, implant and instrument right sizing, and data analytics. So let's take a look at this solution. So the first part of our solution is Smart Card 2.0, which is an AI-enabled planning tool based on surgeon preferences and facility contracts. It has an intuitive shopping cart that benefits is shown. The scorecard reinforces best practices that improves patient care. Visibility in the hospital pricing reduces costs with this adoption of green, yellow, red lights as far as negotiated rates for implants. Equipment availability information, which reduces the delays with real-time communication as far as the need for equipment, loaner trays, what's available, what's not. And it improves workflow efficiency and reduces dependency on some of our outside third-party vendors. The second part, our cart manager, which provides case preparation and optimizes inventory management. This gives full OR logistics. The sterile processing department personnel are able to build case carts more accurately and efficiency. The right materials and amounts are delivered for the procedure, reducing costs and preventing issues from arising while patients are on the table. And it tracks efficiencies and identifies bottlenecks throughout the process with real-time communication for missing items, needed instruments, and incorrect case carts all along the way to avoid problems and troubleshoot them as they come and when it's not too late. And then lastly, our Rep Plus, the virtual surgery assistant for real-time product support. This is a fully AI-enabled interface with image recognition and natural language user interface, which has been shown and still adds to reducing the confusion and distraction in the OR so surgeons and staff can actually focus on patient care. It gives data-driven support, which enhances best practices, eliminates need for additional personnel in the OR, and it has usage tracking, which improves data capture and identifies inefficiencies to reduce waste and contain costs. So recent studies demonstrated that better physician awareness can lead to passive and active cost savings. So not only is this going to improve the care of our patients, but it's going to also help contain the cost of an overdriving healthcare cost system already. So just looking at optimization of treatment choices, this has been shown passively to lower spend by about 20% savings. So if you look at a hospital system that does about 250 hip fractures a year, 1,000 total hips a year, and maybe 300 anterior cervical spine cases a year, just 10% savings off of those average costs can lead to close to $750,000 savings. And I can tell you from experience, these are very low numbers as far as an institution is considered. In addition, it helps from an active perspective with improved contract negotiations to a lower cost of implants and optimize that. As far as optimizing the surgical process, it has been shown by reducing the amount of trays offered by 10 to 30% just by optimizing the equipment that's needed at about $110 of processing per tray with 10,000 procedures a year at an institution. You can see how the savings rapidly go up. There's other multiple potential saving opportunities through aligned decision-making, right sizing resources, improve real-time technical support, and real-time data and analytics. So it's great to save money and to help decrease the cost of care, but what about the people who are providing the care? Well, so being a platform that developed from the inside out by people who live this every day, we took all of our pain points into consideration. So for providers, it's easier for us to focus on patient care, and it also enables institutions to drive efficiency and quality. For the clinicians, for surgeons, it creates a predictable process with increased efficiency, high-performing teams. For surgical techs, it decreases stress and shortens the learning curve. For nurses, it reduces excessive equipment responsibilities and increases focus on patients, all while improving the logistics and enhancing the things that our administrators care about from a bottom line perspective. For the industry side of things, for the sales consultant, it gives increased access to the OR, improves asset management, minimizes in-person verification, and reduces waste from lost equipment. It enables multiple touch points. Facilities can simultaneously support a case at the same time from the same rep, which has been shown to improve the efficiency of the ability to do the job. It reduces excessive manual tracking of equipment, while all enhancing supply chain and logistics and improving risk management and compliance. I love this quote at the bottom. It makes the invention of the laser pointer just about as relevant as a square wheel. So how have we done over the last year or so since we rolled this out? Well, we've completed over roughly 50 procedures, 55 plus users. When asked if we would likely recommend the use of ORtelligence, 100% of them would say yes. And from a net promoter score right now, it's 100. I'm sure that will go down over time, but it's pretty good so far, and we're excited to see that. From a smart card 2.0 perspective, we've learned that it improves accuracy of equipment requests by simplifying handling procedures and equipment variability. It reduces time spent managing preference cards, which saves hours of clerical time. It optimizes equipment utilization by procedure, by enabling accurate inventory management and demand planning. And it enables surgeons' alignment with hospital pricing, all for the AI-enabled cards learning on the go automatically from actual usage data. The Rep Plus aspect has helped create high-performing teams with decreased OR foot traffic, which has been beneficial to both staff and patient infection rates, enhanced communication and improves accuracy through team interactions, shortens the learning curve and decreases staff stress, and reduces surgeon stress by fostering a same team environment all the time. This is a quote from a website, but it just, I think, highlights the advantage to what we're doing here from a virtual assistant perspective. This patient was COVID positive, and this in quotes, the COVID positive status was mitigated by a platform allowing excellence regardless of the implant. So data insights, leveraging learnings in real time. This, I think, the power of this data is yet to be really determined, and decisions now currently are being made on third-party generated data or inferred data, which has built-in flaws and inaccuracies. So we have built this to capture data that tells a story in a proactive way at the point of consumption, which is as accurate as one could probably get. And so what does the future look like? Well, so far we have 2 patents granted, multiple patents pending. The keys to our future right now that we're working hard on is image recognition, utilize AI enhancement of inventory management, the voice user interface with natural language processing to further enhance communication logistics and to enhance data capture at the point of consumption, and optimizing our virtual case coverage. With any good idea comes a great team. This is our team. Tim Donnelly is a co-founder and our chief executive officer who puts in tons of hours to make this project actually real. Jim Krieg, one of our other co-founders, as well as an orthopedic trauma surgeon. Simon Greenman is our chief technology officer, and Brian Kosker, our chief financial officer, as well as the rest of our team working really hard day to day. With that, I'm going to leave you with a very brief video, and we will take questions.
Greater operating room efficiency leads to better outcomes, lower costs, and an improved patient experience. Yet, we are still relying on antiquated, manual processes. It's time to work smarter. ORtelligence is an AI-enabled platform that digitizes and optimizes the operating room supply chain to drive teamwork, efficiency, and quality. It empowers surgical stakeholders with one central platform for scheduling, implant selection and logistics, virtual surgical support, and data analytics. ORtelligence starts when the surgeon logs in to schedule their surgery. Using SmartCard 2.0, a planning tool backed by machine learning, surgeons are...
Well, it sounds like you can't hear the sound too well, so we'll...
The sound was okay, actually.
Okay, then I'll hit play again.
This information is automatically communicated to the entire surgical team, from the industry rep to the surgical technician. Simultaneously, the cart manager provides full OR visibility with alerts for missing items and substitution recommendations while maintaining real-time communication to all personnel. Finally, ORtelligence Rep Plus provides real-time product support with web conferencing. ORtelligence makes it easier for healthcare professionals to focus on patient care while enabling hospitals to drive efficiency and quality. ORtelligence, empowering surgical care teams. Schedule a demo today. Greater operating.
Well, thank you very much. Here's my contact and our website. Please feel free to reach out. It's been quite an honor to present here. Thank you.
Wow, that was fascinating. And it seems like such a no-brainer to just, it's money saving. It just sounds phenomenal. I was riveted, as I'm sure everyone else was. So I'm glad you provided your contact information, and thank you for today.
Thank you, Deborah. I appreciate it. And thank you for 1BW for the opportunity.
Absolutely. Have a great day.